Scoliosis screenings. When do they screen for scoliosis? Scoliosis screening means that we're examining people or patients for the indicators of scoliosis and determining whether further examination or x-ray is actually needed. Scoliosis is the development of an unnatural sideways bending curvature that normally twists into the concavity of the scoliosis. Scoliosis screening typically involves only a physical examination. Now, normally a scoliosis screening involves taking a patient's family and medical history, determining whether scoliosis has been diagnosed in the family before, and if this is a possible risk factor. It's normally observing the patient's posture and gait, standing, looking to see if there's any type of asymmetry in the shoulders and the waist and the pelvis, and really learning how the patient's moving. There's a lot can be learned from this. And then lastly, it's typically involved something called an Foward bending test is performed. And this is really the gold standard of scoliosis screenings. Now, that's the way it should happen. However, unfortunately, scoliosis screenings have a very wide variation of how scoliosis screenings are performed. If they're performed in school, typically they're just performing Adam's bending test. And that normally can catch certain types of curves, but can miss other types of curvatures. And if you don't know there's history in the patient, you may see something small and not take it seriously. But if there's history, maybe you would take it more seriously. So most time, if patients are examined in school, it's just a bending test they're doing. If they're examined in a pediatrician's office or a doctor's office, depending on the patient's or the doctor's familiarity with scoliosis, it could just involve a simple bending test, or it could involve everything I mentioned. But the bottom line is, when we look at Adam's bending test, we know that this is when a patient bends forward at a 90-degree angle and their arms are kind of dangling at the sides onto the floor. This position typically reveals a scoliosis easier because you're flexing the spine into this forward position. Now, this is easier to diagnose a thoracic scoliosis in the lumbar, meaning if somebody has a lumbar curve, you may not see the rib asymmetry or the curvature as easily as you will see in the thoracic spine, because as the thoracic spine bends, it also rotates, and this is where we can see the angle of trunk rotation in the rib cage. If it's in the lumbar curve, the spine is rotating in the lumbar spine, and we don't see that rib deformity is significant. So many patients can get missed in this stage. However, when you bend forward, it's normally easier to see this unnatural curvature. And normally this can be easily detected if somebody understands what they're looking for. But in many cases, it can be missed if the curve's in a different location other than the thoracic spine. Now, the angle of trunk rotation is what I was talking about, spinal rotation. Now, when we look at spinal rotation, we honestly believe scoliosis is primarily a rotational problem that leads to bending and a complex three-dimensional misalignment. So the rotation normally helps us see what's going on. Now, for rotation to be visible without an x-ray, normally needs to gain some size. So you're not going to be able to detect very small curves this way. You may not be able to see 7 or 10 or 15 degree curves. And normally somewhere in that 20 to 25 degree range, 30 degree range is where it becomes easier to notice. And the severity of the scoliosis is typically measured by a Cobb angle, which is typically measured on an x-ray, not in a physical examination. So there's no way to know how big a curve will be, but the more rotation that tends to be, the more the ScoliMeter is reading the ATR out of alignment, the greater chance there is to be a more significant scoliosis. A ScoliMeter is like a ruler with like a level on it. And this level is actually measuring the tilt of the trunk from one side of the spine to the other. And if somebody performs an Adam test and uses a ScoliMeter, they have a better chance of finding a rotation, which could be indicative of scoliosis. Now, most times when patients perform or kids get tested in school, they're just bending forward and they're just looking at them very quickly and seeing if they see any kind of rib differences. Sometimes in offices, they'll bend them forward and they'll use the ScoliMeter on every vertebra from the neck all the way down to the lumbar spine. They're way more likely to find any type of scoliosis, even a small curvature. So this variation in the way the screenings perform leads to a lot of I would say, false negatives. A lot of patients have scoliosis and they never get diagnosed because the curve isn't big enough when the screening's actually performed. And this goes into my point here about when should scoliosis screenings be done. And the problem is scoliosis affect all ages, but it's most critically in children when they're growing. And puberty typically is what leads to progression. So the same person could be examined or screened earlier in their life, say at 10, pre-puberty. They may not find any scoliosis. A year later, they could go through puberty and be checked, and now in their posture exam, they can find a significant scoliosis, because the extent or how fast somebody goes through puberty is unique to that person. And when they go through that pubescent stage, it's also unique to that person. And we also know there's a very big difference between males and females, where males tend to go through puberty much later in life, somewhere around 13 to 15 years of age, sometimes up to 16, where girls can go as early as 10 years of age, can start going through puberty, and somewhere normally on average around 12. So there can be a 2 to 3 year difference. Most kids are screened for scoliosis at the same age in schools. Say everybody that's 12 years old gets screened. Well, you may not catch everybody because some people haven't gone through puberty yet and you haven't seen the curve occur. And we know the scoliosis is a progressive condition that worsens over time, and it's triggered by growth. So checking people or kids all at the same time is never going to be an effective manner of screening patients. And this leads to the caregivers and doctors and their pediatricians and parents to be really looking at their children as they're growing to see if there's any type of curve developing. There is never a reason to have asymmetrical posture, one shoulder higher than another, waist asymmetry, ribs unsymmetrical in an adolescent while they're growing. That's never a normal reason. If you suspect any type of asymmetry, you should take your child to your caregiver or to your pediatrician or to your doctor and point out the concern and see if an x-ray is actually needed to determine if there's anything going on. In addition, if there's any history of scoliosis in the family, screening should be taken much more in consideration, especially even at younger ages, maybe even starting in juvenile and probably even in infancy in some cases, because we know scoliosis has a familiar tendency that if somebody in the family has scoliosis, it's more likely someone else is going to have scoliosis in the family. So with patients that we unfortunately treat patients that are considered severe, that are our average patient is 40, 50, 60 degrees, and they come in my office and they're adolescent, they've been recommended surgery, and our goal is to try to reduce the curve below surgical, which we're successful at. However, a lot of times they'll have siblings, and we'll say, let's check the sibling. And a lot of times we'll examine them and we'll see some small ideas or small developments of curves. We'll take x-rays. And even though the child was recommended, there's no scoliosis, meaning there's no significant scoliosis, but when we take an x-ray, we see 10 or 15 degree curves. Understand that every severe curve was once mild. That's what every severe curve has in common, is that it was once mild. So mild curves left untreated becomes more severe. So therefore, we always recommend the best time to start scoliosis treatment is always the minute you find it, because the younger the patient, the smaller the curve, the more likely they're going to respond better, and the less likely the curve is going to progress. The longer a patient goes with scoliosis that's not diagnosed and not treated, the more risk they have for progression every single time they have a growth spurt. So therefore, early diagnosis and early treatment is by far the best way to mitigate and manage scoliosis. Like I mentioned, scoliosis can range from mild to moderate to severe to very severe. And these curves move through this range of severity. It can be relatively quick depending on growth. So when should scoliosis screenings occur? They should occur as often as patients are growing and developing, and you should be constantly looking at a patient or your child and making sure that nothing's actually developing as they grow. Because as curves get more severe, they're more difficult to treat, and as they're more difficult to treat, there's more limitations on what to expect in the results of conservative treatment. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.